when you talk about older adults and you talk about families and caregivers, you really have two very distinct groups. You have those who are at home, who are still living independently, and you have those who are in long-term care settings, because the world is functioning very different for both sets of those individuals. So for messaging for those folks living at home and still independent, whether you have caregivers in and out or whether your family is a good support system to you or not, that information changes almost daily. That's going to be the most important thing, is to really pay attention to what those recommendations are, and don't stop all the education you've had at this point. Continue to wash your hands, continue to socially distance.
We are still in the middle of this pandemic, and although the weather is getting better, people want to get out and about, we still need to realize that it's still real. People are still dying, not only in our state, but across the nation and across the world. So we still need to, be mindful of that and be careful and practice all the things that they've told us to practice.
When you look at the isolation that people are in a facility, you at that point can see some mental status changes when there's a change in routine, especially if a person already maybe has some cognitive loss. You see a little bit more depression, and I see that in a lot of people, whether you're in congregate setting or not. You see the same four walls every day, you start to get a little crazy.
What we have been focusing on is how to keep people engaged even though we can't get out. And so what we're doing is telling people about the 6 M's of caregiver self-care. So we've been focusing on the first M, which is mail. Write a letter, send an email, just old-fashioned snail mail. Stay connected with people in that way. The second M is music. Be engaged in music. Just enjoy that music that makes you feel good. Movies, you can stream all kind of movies now. Find the things that make you laugh. Find a nice, good comedy to keep your spirits up. And then meals bring people together. Even if you're not cooking as much as you used to, the next M that we talk about is mindfulness. Just taking time to step back and not watch the news cycle 24/7. You just can't do that. You need to step back, be mindful, and then movement. Get moving, even if it's just around your house, walking in place, maybe take a walk around your block, stretch, whatever you need to do to get moving. But those 6 M's, try to remember those to keep yourself grounded and healthy and engaged with others.
A lot of facilities are utilizing iPads to be able to do more virtual things with their friends and their families. For the individuals at home, I think is where you see a higher risk of depression, a higher risk of malnutrition. Making sure that when you are visiting, you're checking in on not just, hey, how you doing today, but really, hey, can you get your medication planner? Can I make sure that we're doing anything? Do you need anything from the pharmacy? Not just, can I pick you up some milk?
We actually are doing teletown halls every single week from the national standpoint, and anyone can call into those and listen, because we really do want people to know there are ways to stay engaged even though we're supposed to stay apart.
From a social standpoint, it's not just the medicine or it's not just the doctors that keep you healthy. Being happy is going to impact your physical health so much. You know your loved ones and you know what they enjoyed. Maybe it's just as simple as, hey, I picked you up some really great smelling body wash.
You can stand on the porch or maybe stand it from your car while they're standing in the door and just have a conversation. A lot of people don't need a lot. They just want that small touch, and that makes a big difference.
Whatever your loved one might enjoy and probably isn't getting for themselves because they're not out and about as much, take that and be able to get them something, fun like that.
So anyone, not just AARP members, find out about anything that we have going on our webpage, and that's www.aarp.org/KY. And on there you can find our movies, our cooking shows, any exercise programs, the teletown halls, all of that information is there. And I invite everyone to check it out.